My name is Bryan Ludwig. I'm a neurointerventional specialist here at Miami Valley Hospital. There was a need for treatment of intracranial vascular anomalies, or basically problems with the vessels, arteries, and veins inside of the head, beyond neurosurgical realm where you have to open the skull and do these things with pretty invasive and obviously labor-intensive and obviously high-risk procedures. So when the cardiology world started using angioplasty balloons and stents and things like those devices to work with arteries in the heart, it was a natural jump to say, well, why not start creating and using some of these devices for vessels inside of the head. The nice thing is that the ultimate result of that is that we're able to treat aneurysms. We're able to treat arterial venous malformations. We're able to embolize tumors in the brain. We're able to hopefully reverse stroke and remove clot that could be causing stroke, all with wires and catheters in a very minimally invasive way to ultimately affect patient outcomes in a very positive manner. There are not a whole lot of us out there. Thankfully, at this point, Miami Valley has 3 of those individuals stationed here covering this hospital 24 hours a day, 7 days a week. I believe there's only around 9 or 10 of individuals that do this kind of work in Ohio itself. And to have 3 of those individuals is a pretty high percentage. And it gives us a team that should be able to really rival what you might see at a bigger institution or a bigger university institution. And with the advent and the sort of coming about of the neuroscience collaboration with Wright State University, we're going to be heading that direction and more of an academic feel to this hospital in the future. I grew up in Dayton. I had been away from Dayton for about 10 years during my training, and I went to undergrad at Ohio State University. I went to medical school at the University of Cincinnati. Then I spent some time at Vanderbilt doing my residency and chief residency. And then from there, I spent a little bit of time at the Cleveland Clinic, and then took a 3-year training program in interventional radiology at the University of Iowa. Our patient population consists of both the emergent and the elective. The emergent patients being acute stroke, someone who has a clot that's blocking a vessel, or a tear in the artery that may be not allowing blood flow to get to the brain. Those are things that we repair. Other emergent situations would be everything from a ruptured aneurysm, bleeding inside of the head that we would repair, to arteries and veins that are connected in abnormal ways that have tendencies to bleed, which we fix. Things like nosebleeds that are uncontrolled, cancer patients that have tumors eroding through tissues in their neck or nose that cause severe bleeding that really cannot be controlled, sometimes as life-threatening. We can use our catheters to go through the arteries and close those arteries down from bleeding and get pretty good results. The elective portion are people that have narrowings in their vessels in their neck that haven't yet had any, hopefully, had any permanent neurologic damage, but that have clearly need for balloon stretching and stenting and trying to open that vessel, as well as patients who come to us with unruptured aneurysms that have been discovered incidentally off workups for headaches or other things, and have been found to have something that's high risk for a possible bleed. And usually, in those cases, are often very rewarding because the patient will be in the hospital for no more than 3 days and back to work within a week and have the aneurysm treated. And it's pretty spectacular technology to see these patients do so well and have such a massive problem essentially cured. People that surround me on a day-to-day basis, everybody from the angio technicians to the angio suite nurses. This is where we do all of our procedures. And obviously in the neurocritical care world, the ICU nurses, the ICU staff have all been very supportive, not only supportive, but excellent in adopting a lot of the sort of newer technology that we're bringing in. And we're outreaching to physicians and surgeons who tackle vascular tumors to try to embolize such things so that they don't have the bleeding complications during their procedures that they may if you didn't do these things beforehand. We're reaching out to the cardiologists who that maybe trying to revascularize some of these neck vessels, that can be pretty risky for stroke and other complications. We're reaching out to the neurosurgery crew, saying we're here to treat these aneurysms that can be very high risk, to go in and try to do any kind of intracranial work with opening the skull. We can do these minimally invasive. The administration, speaking on their behalf, they've been fantastic. They're very physician focused in terms of they look for direction from the physicians, not the other way around. And they have shown us nothing but support, as well as cooperation in trying to get our message out there and to make our transition into creating this neuroscience center as smooth and as rapid as we possibly can. And they're clearly interested in the outcomes of patients, and that is refreshing to see an administration that's their endpoint.